we focus so much more on how it affects us, and most other people, they're not even paying attention. For me telling people was a way for me to regain control back. I learned that I can't change the hyperhidrosis, but maybe I could have a more fulfilling life if I'm not hiding it as much. I've been through it all, and so to be on the other side of it and guide patients and be the support that I didn't have, there's really nothing that can explain how much that motivates me.
You're listening to the Sweaty Girl Society podcast, a show for women with hyperhidrosis where we share tips for living better with excessive sweating. I'm your host, Karina. Now let's get into the show. Welcome back to the Sweaty Girl Society podcast. In this episode, I'm speaking with Kristen Hernandez, hyperhidrosis advocate and founder of To Hyperhidrosis. Kristen is also a physician's assistant. In this episode, Kristen offers lots of practical tips to help you navigate the healthcare system and advocate for yourself. I think you're going to love this conversation. Kristen, welcome to the show.
Thank you for having me.
So in addition to being a hyperhidrosis advocate and having hyperhidrosis yourself, you're also a certified physician's assistant. For those of us outside the U.S. like myself, can you explain what a physician's assistant is?
Yes, so a physician assistant, abbreviated as PA. In some states now it's considered a physician associate, so either one of those are interchangeable. We can diagnose, we can treat, we can prescribe, and see patients on our own. In some states like California, we have to be working under a doctor or MD. But otherwise, we have autonomy of our patients. So I have my own patients that I can see. And then right now I'm working in internal medicine and pulmonology.
So what led you to enter the medical field?
I always had just this inclination towards helping people that's so general. And so at a young age, I was volunteering. I was working in semi-medical related field. So I was an MA, and then I worked for the hospital to raise money, but there was always something missing. And I always had this idea like, oh, I want more hands-on experience, which is ironic considering how hyperhidrosis is so hands-off. Like, I don't want to touch people because of my sweating. And so that's kind of what took so long, I guess you could say, to get me here. I just had so much doubt. Like, can I even do this? I'm terrified of touching people. So I volunteered in the hospital, and I used that as my way of being like, can I actually do this? And over time, I became more comfortable. So then I did all the prerequisites, but it was always a challenge because my hyperhidrosis was affecting me academically. So I was having really bad test taking anxiety because during the exam, I was not even focusing on the test. I was focusing on my sweat and how to manage it. Because I was like, I don't want to wet my Scantron, which I've done multiple times. Then I had to turn it in once. And the professor's like, why is it wet?
Yeah.
Like, and like, how do I explain this? And so it started to affect me academically. I wasn't doing well in school. And at that point, I started to seek accommodations. So it's been a challenge to get here, but it was ultimately always something I wanted to do.
Yeah, whenever I hear of somebody in the medical field who has hyperhidrosis, I immediately think of wearing gloves. How do you navigate wearing gloves? And I guess, do you sweat on your hands?
Yes, so I sweat my hands, my upper lip right now, my nose, my lower back, my underarms, my ankles, behind my knees, everywhere, my scalp. I sweat, all the places. So yeah, a major thing. I remember working in the hospital and it would take me, it felt like 5 minutes, but just to put gloves on, I'd be like, okay, 1 second, like trying to get it on my hand. And I was like, oh my gosh, this is so embarrassing. But it's funny because I learned over time too, we focus so much more on how it affects us, and most other people, it doesn't even faze them. They're not even paying attention. They don't know what's going on. So for me, a lot of the times, if I was in my rotations, I would actually just tell my preceptor, like, hey, I have hyperhidrosis. My hands are really sweaty. My face sweats. So if you see me putting gloves on and it's taking a minute, That's why. Like, it's a little bit of a challenge. They're like, okay, yeah, that's fine, whatever. But yeah, so putting gloves on is always a challenge. But I actually had a conversation with one of the people from the community who asked me about this. And you find ways to adapt, like I said. So, for example,
You
I
do.
would put hand sanitizer because one of the things in school they teach you is before you see a patient, you have to wash your hands or put hand sanitizer. So I would do that. And if my hands were still really sweaty, I would grab a towel from the room, wipe my hands down, then get my gloves and try to put them on. And again, patients don't even think about that. They don't even know what I'm doing. And it doesn't affect
Hmm.
my ability to do what I need to do. If it took a little bit longer, which sometimes it still does, I talk to them and ask them more questions about why they're there or other things about their personal life. So I kind of fill the time if I need to.
Yeah, I find that it's often we're so focused on it because we're living the
Right.
experience, but people don't pick up
Yeah.
on it. That's interesting that you told your preceptor. Do you feel like you've had more empathy in the medical
Mm,
community?
I think it took me many years to just be able to say it in general. There was a
Yeah.
moment in my life where I had like a sit down with my family to be like, this is my reality. And I was crying because I was like, I don't think you guys understand. I may seem like a happy person, but there's a lot of challenges I face that you guys have like no concept of what I'm going through. And so just that was like one step in my journey. And then going to
Hmm.
therapy was another step. And I think therapy is what allowed me to find the words to express what I was feeling and also explain my condition. So by the time that I got to PA school, I already knew I just need to say it up front because it was a way for me to gain control back. Hyperhidrosis, you have no control. And my entire life, you try to control things as much as you can, but despite that, you still sweat excessively. Like there's really not much you can do. And so I always had that
Hmm.
battle. And so for me telling people was a way for me to regain control back. So telling my
Yeah.
preceptors too, because I knew it was going to be a challenge for me. And there were even instances in PA school where we do physical exams on our classmates. And one of them is doing a physical exam on the feet. And I was like, absolutely not. I was just like, I
Mm,
am not. I know I'm a hyperhidrosis advocate, but I'm also a human being and I'm also a patient that is like gravely embarrassed and I don't want people to see my sweaty feet. So I told my professors if someone else needs to check someone else's feet, they can to practice. But this is just something that I really feel uncomfortable with. And they're totally fine with
hmm.
it. They're like, that's fine. If they really need it, they'll use another person's feet. And so, in that way, I was able to advocate for myself while also maintaining that feeling of safety and control.
Yeah, it takes a bit to get there, right? Throughout my life, there's been times I've gone for a massage, and the massage therapist is going in the direction of my feet. And in the past, I would have let them touch my feet and been really uncomfortable with it and been a freeze
Right.
response, I guess. Whereas over the years, as I've gotten older, I can advocate and say, now, let's not touch my feet. I don't need my feet massaged today. Like I have hyperhidrosis, or just leave it,
Right.
right? But it takes time to be able to talk about it. You have talked before in other interviews about your journey with therapy. Can you speak more about that and how that transformed your viewpoint on your condition?
So for me, getting therapy was, I mean, I felt in some ways I was a hypocrite. I'm going into a field where I'm telling people to get help, but I couldn't even seek therapy. So who am I to tell someone else to seek therapy if I can't even do it for myself? So that was a motivation for me to take that first step. And it's terrifying because I'm like, oh, they're going to think I'm crazy. They're going to think you are the problem. This is what's going on. And in reality, it was the complete opposite. For the first time, I could talk to someone without feeling like I was being judged. And for most of my sessions, I was crying. It's exhausting because I was in my mid 20s when I started therapy. So I lived majority of my life because I've had hyperhidrosis since I was 4, just hiding this all in. So a lot of those sessions, like I said, were
Yeah.
crying and just literally getting it out.
Yeah, having a witness, having somebody hear your story.
Absolutely. It was like life saving for me in a way because it was also a realization, again, going back to the hiding and the lack of awareness I had about my condition, was how much it was actually impacting me emotionally. For a lot of us, we live with chronic stress because we're worried about it. And even if someone else doesn't care or doesn't notice, if anyone is sweating excessively 24 hours a day, it's uncomfortable. And that goes back to the sweaty feet. You may not care about my sweaty feet, but it literally just feels uncomfortable. Like right now, I'm sitting in my socks and my feet are sweaty. And I'm used to that feeling, but it's not like the most comfortable feeling. So
No, same,
Go, yeah,
same.
so going to therapy and learning how to talk about it and express what I was feeling, I think was such a huge thing for me and in my progression with dealing with hyperhidrosis because I also learned that I can't change the hyperhidrosis, but maybe I could have a more fulfilling life if I'm just more upfront and not hiding it as much. And it
Hmm.
was, in my personal experience, life changing. And that's why I recommend it so much for people because hyperhidrosis is not just a physical ailment, there is such a psychological component to how it impacts us on a daily basis.
So, where would you say your relationship is today with hyperhidrosis?
I think it's definitely better than what it was. I think it goes back to me feeling comfortable talking about it. I have grown a passion advocating for hyperhidrosis, and having you and Maria and all the other advocates talk about it definitely makes it easier to talk about because you know that you're not the only one out there. And so, in terms of my relationship with hyperhidrosis, I feel at ease and I feel more confident in my current state. Right now, I'm not doing any treatments, and I know 15-year-old Kristen would be devastated by that. Um, it's not
Mm-hmm.
necessarily because there aren't certain treatments that can benefit me, it's just because I live my entire life focusing on hyperhidrosis and trying to fix it. I mean, and this is what therapy helped me with, is sometimes I don't need to fix everything. I can just be. And that in itself has relieved a lot of the stress of living with hyperhidrosis. Finding the comfort in my own skin. Yeah, I feel like I have a healthier relationship with hyperhidrosis for sure.
I can really relate to that. There is a certain level of freedom when we accept that this is the way it is and aren't striving always to find the
Right.
fix. So, in terms of your journey with hyperhidrosis, when did you receive an official diagnosis and what was that experience like for you?
So in PA school, I presented on this in my classmates. This is where my advocacy, I was like, I need to tell the whole world about this because I know one of my classmates is going to run into a patient with hyperhidrosis. And what I learned in that is that the average diagnosis time period is 10 years. And that is totally on point with me. So I had hyperhidrosis at the age of 4. I didn't get diagnosed till 14. I went to a dermatologist. They did the sweat iodine test where they put iodine, they let it dry, they put powder,
Oh, they did.
and yeah, and it turns black and it shows where the sweat is. Nowadays, I feel I can tell if someone has hyperhidrosis. I don't know if I need to do all that testing. But yeah, so they did that test and they're like, okay, you have something called hyperhidrosis. And I will never forget this. The doctor was like, well, we know that it's hyperhidrosis, but there's currently nothing we can really do and there's no cure. And so the first thing they recommended was these topicals, which were really irritant to my skin. And so I didn't use those for very long. And then later they recommended iontophoresis, but at that time the machines were made a lot differently and were really painful. And when I'd ask for advice, they didn't really know. So it was, here's the device, figure it out. This is maybe what you should do. But there wasn't really any guidance on, okay, well, what if this hurts a lot? I can't sit here for two
Yeah.
minutes, let alone 10 minutes or 15 minutes. And it was essentially like, well, that's what you have to do. So I would sit there in agony. And eventually that also didn't work because it was too painful. I was like, it's not worth it. I couldn't do it.
Mm-hmm.
Um,
Yeah.
and ultimately, I found a doctor through a family friend. And I went to this doctor, amazing. Like, so informative right away. They were able to explain the process and super supportive. And it was just like, someone knows what this is and understands it better than I do, which was such a relief because, as many of us, we always have to explain and explain what hyperhidrosis is and why it's so debilitating and why you need treatment and why, right? There's always so much explaining.
Mm-hmm.
So this happened to be an endocrinologist. I was with this doctor until they retired, and I was really fortunate. I started oral medication, which worked really well for me for about 7 years, and I tried different ones. And then ultimately, I started to get side effects like a migraine. And again, it was kind of at that point where I was also like, I'm okay not doing anything. So I just stopped medication.
Your journey sounds very similar to mine in terms of the initial
Mm-hmm.
diagnosis. When you said 10 years, I just did the math on mine too, and it was precisely
Yeah.
10 years. My earliest memory of hyperhidrosis was around age 10, and I got diagnosed when I was 20. I find that interesting that they did the test. I recently went to my doctor because I was interested in trying
Mm-hmm.
glycopyrrolate, and my doctor started asking questions like, how do you know you have hyperhidrosis? Where do you sweat? This sort of thing. Because I've never had the test
Right,
that you
right.
were describing done. And I just held up both of my hands, which were dripping. And I stood up from the examination table where I had completely soaked the paper
Yeah.
lining. And she's like, oh, okay, yeah, you have hyperhidrosis, right? So,
Great.
which is interesting around diagnosis because I've come across the question in our community and in the world, how do I know I have hyperhidrosis? How much sweat is normal versus how much sweat means hyperhidrosis? And I think for those of us who are confident that we have hyperhidrosis, it's quite
Right.
clear. But what qualifies a diagnosis of hyperhidrosis?
That's a very interesting question because you're right. For some people who have like severe excessive sweating, it's very clear. For others, it may not be so much. And when I was doing research regarding it, that's what I struggled with is what is the actual parameter? There was some that was like, if your sweat beads are a certain amount of centimeters or millimeters. And I'm like, who is going out here measuring my sweat beads on my hand? That's not an accurate description. And
Mm-hmm.
then there was a scale of how much it impacts you on a daily basis. And I was also like, well, that's
Mm-hmm.
not exactly related to the sweat, the physical component, that's more the psychological component. And so, in terms of dermatology diagnoses, a lot of these are based off quality of life scales. But I always ask, are you sweating when you're just sitting? Do you start excessively sweating when you've just woken up? Are you sweating at night? So, all these instances where the average person is not, I typically ask those types of questions. And that's a red flag. Like, okay, this seems more likely to be. It's also very important for patients to go to their providers or clinicians because they need to be screened for other conditions that can cause excessive sweating. So, whether it's related to the pituitary gland or their thyroid, there's a lot of reasons why people can have excessive sweating. Maybe it's a medication they're using that's causing excessive sweating. Hormones. I have a lot of patients in menopause that are having hot flashes. So there's a lot of reasons why we can excessively sweat. So one, in terms of the initial diagnosis, it's kind of based off the patient's experience, some of those questions. And then I always ask, bring a video because maybe they're dry in the office and they're like, oh, of course, I'm trying to prove myself and my hands all of a sudden became dry or my face is dry. Providing video or images can really be helpful. So making sure that they screen for any other conditions first and then doing hyperhidrosis evaluation next.
Gotcha. So, as a physician's assistant, have you treated many people with hyperhidrosis, whether they've come to you for hyperhidrosis or you notice it as part of other
So
treatment?
the first patient I had was during my dermatology rotation. I had an opportunity with a patient and it happened to be their first time coming in at all ever to get treated. And I was like, I have hyperhidrosis. I completely understand. Where do you sweat? And I feel like I was able to ask questions that maybe other providers, at least they never asked me, like, do you sweat here? Do you sweat there? Just to get an idea of the extent of the hyperhidrosis and also to figure out what type of treatment would better fit them. So that was my first hyperhidrosis patient. I've had two other ones that I've been able to help and manage, but it's interesting you asked because where I'm at now, I'm now ready to see patients in office and do consults and see patients for hyperhidrosis. So if anyone out there wants a hyperhidrosis advocate and clinician who treats hyperhidrosis, I'm your girl.
Wow, that's
Yeah.
amazing. I haven't heard of many people who specialize in hyperhidrosis other than a Botox
Right.
clinic or the treatment
Yeah.
side, but to actually get the diagnosis and help navigate care, that's really
Yeah,
exciting.
I'm excited about it. And it's like a part of little Kristen heals because I'm able to give something to someone that I never got. And at the same time, I feel sad because I'm like, gosh, my experience was so terrible. But it's kind of that balance. It's so rewarding that I can give back in that way.
Now, one thing on a slightly related topic is for me, going to the doctor has always been triggering of my sweat because I anticipate having to lay down or sit on the table with the paper. The paper that covers, I don't know what the medical term for the paper
Yeah.
is, but I always sweat through it. Is this something you've experienced, and what advice, both as being a patient of care
Mhm.
yourself as well as a provider of care, what tips would you offer to somebody going to a doctor's appointment so they can make it more
Mhm.
comfortable for themselves and not have to have these reactions?
So that's a great question. So sometimes in these exams, it depends on what type of exam. So one, I'll ask, do I need to completely undress or can I keep my shirt on? Like, can I keep, whatever they're examining, I see if there's any part of clothing I can still keep on. Second, it's kind of hard because, I've experienced the same thing. I'm sweating through this paper. I'm sticking to it. It's dripping and sticking to my body. Like, oh my gosh.
Yeah.
Um, and so in those exams, I keep my socks on at least. That's where
Yeah.
I'm at least more comfortable. But yeah, it's really hard. I do know that Maria did a post about it and she brought her own towels and her own resources so that she could lay. I think she was laying on a towel or using it for her hands, one of the things. So that's a way we can feel a little bit more comfortable because not all offices have towels readily available.
And that's Maria from My Life as a
Yes,
Puddle, her blog.
exactly.
She did a blog post on it.
Yeah, so
Yeah.
she had shared that tip and I'm like, oh, that's a really good idea. But honestly, sometimes when I go to the doctor, I completely forget. I think
Yeah.
that's one way that you can help at least make yourself feel a little bit more comfortable. Like you said, the paper is like, oh my gosh, the paper.
Yeah. It's just
Can
the
we get a different
horrifying
paper,
moment
please?
when you have to get
Yeah.
up. Yeah. And the gowns being that blue,
Yes.
it just shows the sweat so
Yes.
much.
Yeah.
And yeah,
So
yeah,
sometimes
can be
what
an
I'll do
uncomfortable
is like, let's
experience.
just say we're doing a full physical exam and I can only leave my socks on. I will keep my sweater on my side so at least I can use it to soak up my sweaty hand. Or I can just grab it. And then when they need to check this area, I'll move it. But it's kind of like a hanky essentially that I just keep with me.
Yes, it's key to have some things at the ready to soak up the sweat
Yes.
with. So, what advice would you offer to somebody who wants to speak with their doctor for the first time about hyperhidrosis? I know that can be a bit of a scary thing as well. I remember speaking with my doctor for the first time, and I was like, will she dismiss me? Will she believe me? Will she think that I'm gross? Is this even a real thing? So, what are some pieces of advice you would give to somebody?
So I did a blog on my How to Hyperhidrosis blog about how to prepare for a doctor visit. And one of the things I talk about is writing all your questions down that you've thought about, that you want to know about. So bring in a list. I always tell my patients, bring a list in next time because sometimes you're in there and you forget everything that you wanted to ask. And then second is providing images or video to show proof of your hyperhidrosis. It doesn't have to be your whole body, but just certain spots just to show evidence in case you get into the office, the AC magically dries your hands or whatever, and then you have no proof. And then one of the other things I've done in the past is I've called the offices before I even make an appointment. And I'll ask, does the doctor treat hyperhidrosis? If they're not sure, can you ask? What type of treatments does he or she provide? Because I've been to offices where it's like, this was a waste of my time. Also, I don't want to pay another copayment in the United States where we have insurance that we have to pay a certain amount. I don't want to waste my money on a physician that doesn't know what's going on. And so those three things I think are the main things. So writing your notes, videos or images, and then interviewing at the office that you want to go to. Now, if you don't have the opportunity to pick and choose what clinician you go to, then having those questions and video and images is really important. It's also important because a lot of these visits are 15 minutes, maybe. So you have to take advantage of that time you have. So even if you do have a long list of questions, trying to pick, okay, if I'm limited on time, what are the top two things that I absolutely need to know by the end of this appointment? And that way you have a starting point. You can do a follow up and then go from there and ask the rest of your questions when that next appointment is.
That's great advice. So in the US, what is the pathway you would follow? In Canada here, we would typically go to our family doctor first, and then the family doctor would refer us to a dermatologist. Is it similar in the US?
So it depends on insurance. So there's PPO insurance, there's HMO insurance. The PPO, for the most part, you can go anywhere you want. So you don't have to go through your primary doctor. You can just go straight to a dermatologist, straight to an endocrinologist. Now, with that, some offices, so dermatology, the specialties will require a note from your primary to say they need to be seen. And that's because a lot of these offices are really, really busy. So they want to make sure you're coming to us because we actually need to see you type of thing. So there's that caveat. And then with some HMO insurances, you need authorization, meaning similar to you, you have to go through your primary doctor and then they have to refer you to a specialist. Or, if you work in internal medicine or family medicine like me, and you already know about hyperhidrosis, you can skip that step and just be treated by your primary or your internal med doctor. So that's kind of what I was doing in PA school. I did a pediatric rotation and I did a presentation on hyperhidrosis because you were 10, I was 4. We could have been screened at a younger age and maybe had a better quality of life for those 10 years that we weren't diagnosed. So yeah, there's a lot of different avenues, but in the United States, it's kind of dependent on insurance.
Okay, interesting. And that raises an interesting point. From what I know, at least in Canada, it's a dermatologist that would treat hyperhidrosis typically. But is it really a dermatological condition, right? There's a lot that we don't know about hyperhidrosis, and who is the right person to treat it. Do you have any thoughts?
Yeah, I've always had a challenge with that as well, just because also my personal experience. One of the doctors that helped me the most wasn't a dermatologist, it was an endocrinologist. And they understood the pathophysiology behind hyperhidrosis and they explained it to me. I was like, oh, I never understood it this way. And so in that respect, I don't know if a dermatologist or endocrinologist or a family medicine or internal medicine is the best. I think it just depends on who has knowledge on it, unfortunately. That's kind of where we're at because there are a lot of gaps within these specialties. Some kind of know about it, some kind of don't. Now, as far as the United States, there might be some procedures that you can do at a dermatology office, but you can't do at an endocrinology office. So, for example, Botox. That's a widely cosmetic procedure, and so it overlaps with it being a procedure for hyperhidrosis. So it makes sense that they would be the ones handling that. In terms of oral medication, yeah, they can also handle oral medication. So technically it is a skin related condition, but it's more of a neuroendocrine possible condition. And that's the research we need to better understand and appropriately assign who should be addressing or dealing with these types of conditions. And then on top of that, educating this population of providers so that it doesn't matter who you go to, someone will still be able to manage you. Because right now, there could be a whole list of dermatologists that treat hyperhidrosis, but not all of them are equal.
Right, yeah. It's interesting because hyperhidrosis presents on the skin. That's the obvious symptom is the sweat, but there's so much more going on. behind the scenes, and there's so much we don't know. So, where are you hopeful research will go over the next decade?
It's hard to say because right now there's a lot of limitations with research. At one point, there was research being done regarding genetic testing for hyperhidrosis and its overlap with POTS. And so I don't know how far they are into the research, but that was just very preliminary. A lot of the research is solely done on underarm treatment, which in some ways is a disservice because we know that we sweat in multiple places and we know that the underarms is the easier part of the body to treat. But the face, I mean, for me personally, that's the hardest thing to hide. My hands I can hide in my pockets, I can
Mm-hmm.
hide with the sweater, but my face I can't hide. So
Yeah.
that I think has always been a challenge in terms of how to manage it.
Yeah, we had a conversation in the Sweaty Girl Society community about this, and if there was one place you could stop sweating, what would that be? And most people did say face. Whereas when my doctor asked me, the first thing she said, "Do you sweat in your underarms?" That was the
Right.
first thing that she went to. People often think underarms, hands, feet. And of course, underarm sweat is not fun. It can be very embarrassing, but there's so many more areas that we sweat in, like the groin, that rarely gets talked about. But as I speak with more and more women who have hyperhidrosis, that is a very, very common place
Mhm.
that we experience sweating.
Right.
And you almost never hear about that when you see the list of where people
Mhm.
sweat. So, lots of work to be done about how we talk about hyperhidrosis and how we communicate it.
Yeah, and in other countries, Botox is a covered procedure, meaning patients don't have to pay and it's cleared to be used for Botox to treat hyperhidrosis all over the body, including the groin. Whereas here in the United States, it's only approved for underarms and hands, I believe, and feet. So anywhere else on the body, it's not
Okay.
covered. So even though I have hyperhidrosis on my face, I've gotten Botox, but insurance will not cover it. So I've had to pay 300 some dollars out of pocket. And that's kind of the
Hmm.
burden that we have to pay literally in terms of finding treatment because it worked for me. It worked for 3 months. I would do it. But again, it's money out of my pocket that it's a lot of money to be
Right.
spending on treatment. And it's effective for some people. And that's the thing with hyperhidrosis treatment is what works for me may not work for you. But if Botox works for me, but now I have to pay $400 every 3 months, and then there's another patient who can get hyperhidrosis treatment that is covered by insurance, it's just not equal in that respect.
For sure. Can you talk a little bit about your advocacy work and what led you to start your blog and become active on social media?
Yeah, so it started during the pandemic. I was working in the ER. It was very hectic. And at the same time, I would happen to be doing therapy. And it's kind of an outlet, I guess, that I used to just express what was going on with me. Never in a million years would I have thought there's so many people out there with hyperhidrosis. And so it was a therapy for me because I would be up till 3 a.m. making my blog. And I'm also a creative person, so I like the aspect of creating something and designing it. And so that's where it started, was something I was doing as a hobby. And
Mm-hmm.
then I started to learn there's other people out there. I learned from Maria, My Life as a Puddle. I found her page and she invited me to participate in an article for her blog. And that gave me more confidence in talking about hyperhidrosis. I was like, there's not a place at that time where you can see hyperhidrosis, see possible treatments. And so that's why I created the blog. And then the Instagram followed. I wanted to be honest and talk about the things people didn't want to talk about. That's generally my personality. I'll say things that might shock people. Um, and so talking about, growing sweat and all these things that we were so ashamed about sharing in regards to our sweating is something that I was like, oh, I definitely have to approach that or discuss that. And so that's where it started. And then it just became something that was very rewarding, and it motivated me more to become more active. I think Maria was definitely a guiding light in that. We call her the OG for a reason.
Yeah, for sure. I really appreciate your stories that you post of everyday moments in
Yeah.
your life where you have some face sweat happening or your hands are sweating. I just think it helps to
Mm-hmm.
normalize everybody's experience and show what it looks
Right.
like to live
Yeah.
with hyperhidrosis. So, what's next for you for your work, both in the medical field or online? What's next for your advocacy work?
So, right now, as I mentioned earlier, I'm now starting to see patients in the office. We can also do telehealth. So, I'm really, really excited, again, just to be able to be on the other side of things as a patient for so long and struggling with, again, advocating for myself, getting the treatment I needed, being on the phone with insurance, asking why my medication wasn't covered. I've been through it all. And so to be on the other side of it and provide that resource and guide patients and be the support that I didn't have, there's really nothing that can explain how much that motivates me to advocate for hyperhidrosis, because I can finally give back and give people proper treatment.
That's amazing. Well, there's not that many voices in this space, so really appreciate what you're doing.
Thank you, Karina. And I'm so
Yeah.
happy that you're now part of our advocacy group, because we do need more voices out there.
Yeah, absolutely. Thanks for that. So, where can people find you
So
online?
online, my Instagram is how to hyperhidrosis. And then my blog is also howtohyperhidrosis.com. And if you want to see me as a patient, I'm located in Burbank, California. And the phone number is 818-843-5864. Ask that you want to see me for hyperhidrosis and they'll schedule an appointment. I'm super, super excited about that, because again, it's just the next step in advocacy for me.
That's right. That's amazing. And we'll put all your contact details in the show notes and in the description. And thank you, Kristen. I learned a lot today. A really great conversation, and I really appreciate your
Thank
time.
you. I'm like so grateful that you invited me here, and I love talking about hyperhidrosis. So thank you again for having me.
Thanks for listening to the Sweaty Girl Society podcast. If you liked today's episode, join our free membership community at sweatygirlsociety.com/community.